three little bones that are very complicated. We studied scapula and the humerus and the collarbone and how those hooked your entire shoulder girdle complex on your body. We started to explore, and I would say we just started to explore because it's complicated, how 5 main muscles attach my scapulas to my axial skeletal system, to my spine and thorax. And then we started studying some complex muscles that actually attach my humerus to my scapula and move that around, things like that. And we are now going to be moving to chapter 4 of your trail guide book, which is the spine and thorax, and actually looking at the spine and thorax more carefully. This will allow us to look at things like the spinal erector muscles in your back, and the multifidi, and rotatories too. So somebody said the multifidi, it's kind of a funny name, and it is, by the way, and actually my high school students used to always call it multifidi, and so now I can't say it right anymore after that, but it is multifidi. But occasionally you hear me actually say it because I got it in my head. Anyway, so we'll learn about that and really about the miracle of how your body kind of keeps this spine and thorax up and all that good stuff. And that'll allow us to re-review the muscles that hook onto your scapulas and work your arms and all that good stuff. So that's where we're headed right now. And this is a pretty important chapter. I mean, I honestly think anything in the trail guide is a very important chapter. But obviously, people come in and they want their back and shoulders rubbed all the time. And you'd like to be just a little bit better than somebody else who's just kind of rubbing over it. You'd like to get to the spots that people aren't used to you getting to and things like that. So, let's present a little PowerPoint. What I'm going to be talking to you about today is about bones in the spine and thorax region. And then we're going to talk about some of the muscles that you already know that attach to those before we get into lots of new ones, if that makes sense. Cool, cool, cool. All right. I don't think that's super necessary. Okay, so some of this should not come as a big surprise because we've been talking about it, luckily. This is a posterior view, meaning we are looking at the back view of somebody. We can see in blue there are 7 cervical vertebrae. We can see in red, I guess I'd call that, there are 12 thoracic vertebrae. And yellow, we can see there are 5 lumbar vertebrae. Don't know where we got that from, yes. 7, 12, and 5. And underneath the lumbar vertebrae, we can see the sacrum. Remember, all your vertebrae have little discs between them. These are cartilaginous joints. They don't move actually that much, but when you put 24 together, you get lots of movement. And we can name all these joints, by the way. We name joints between vertebrae the same way that we name joints between bones. So if this was your 5th lumbar and your 4th lumbar, this would be called L4, L5. That is the joint, literally. This joint is L4, L5. We just named it by the 2 bones that come together. So the 2 that you're going to hear the most of in your entire life, and I'll explain why in a second, are L4, L5 and L5, S1. S1 stands for sacrum because your sacrum used to actually be separate little sacral discs that fuse together, about 4 of them. And so they'll still refer to it as S1. And you will hear people talk about ruptured discs in L4, L5 or L5, S1 all the time. It is the most common place to have a herniated disc in your back. It's the most common place to have some bulging disc problems. L4, L5 or L5, S1. Why? So, whose hand? Oh, thank you. Ms. McDowell, please.
Well, that's kind of like the bottom of the axial skeleton, so I think it bears the most weight in relation to the rest of the vertebrae. So if there's going to be a break, it's probably going to be probably a lot of movement too with the hips that could also do something.
Well, I could not have said that better myself. That was very well answered. Yeah, and you, I love, by the way, you used anatomical terms when you're talking about it, and I also like you made it simple too, which is the fact is C1 is holding up my head, C2 is holding up my head, and C1. C7 is holding up C6, C5, C4, C3, but L5 way down there is holding up all the lumbar, all the thoracic, the ribs, the neck, the head, and the arms. All that comes down at that base, and you're absolutely right. That seems to be like we rupture that area the most. So even those are your biggest vertebrae, they're also under the most pressure. So you'll often hear people say, yeah, I've got a herniated disc at L4, L5, L5, S1. One of those two things. I'm not saying you won't hear other stuff, but that's just super common for the reason that Miss McDowell just so eloquently laid out for us. Thank you very much. Yeah, well said. All right. What do we call, what's another name that we give your first cervical vertebrae, Miss Trotter? Sorry, Miss Trotter.
Is it the atlas?
It is the atlas. Thank you very much. And what is the name that we give the second cervical vertebrae, Miss Lobitz?
The axis?
Yes, axis, exactly. So the skull articulates with C1, and that's actually how you get this kind of action. But C1 articulating with C2 is how you get this. C1 actually rotates around a tiny axis that's in C2, actually. There's a little tooth-like projection there that we'll study about. C7, it's not in here, but some people, old people like me, call C7 Vertebra Prominence. It's the most prominent vertebra to stick out. And that's it. Yeah. Miss Walker, why? Can I ask you a question? Why? How do we know a thoracic vertebrae is a thoracic vertebrae? Like, how do I?
It's connected to rib.
Thank you. Thank you. That's exactly the answer I want. Yes, they are thoracic vertebrae because they're associated with ribs, period. Cool. Okay. Let's move along. I feel like you guys have a lot of that. Okay, so we all know that this is the sternum here, right? They're going to divide the sternum up even more. So the sternum actually has a body of the sternum. The top part we actually call the manubrium, and the bottom, and I'll explain this in a second. And the bottom part, right down here, and you can push this on yourself. It should not feel good. There's a little like bone that sticks there in your solar plexus, and this is the xiphoid process. So all that was really your sternum, but they're starting to get more nitpicky and name certain parts of your sternum. So what it is your sternum is this whole thing here, but we notice right up around the second rib, your sternum angles way back all of a sudden to get to the first rib. And some people even call this the sternal angle, where it bends back here. And then you get the manubrium, which is the top part of the sternum. The manubrium is where you have your jugular notch, which is this nice little rounded out area here. This is also where you have the sternoclavicular joint, the only thing that attaches my entire arms, everything onto my body via bone joint, is the sternoclavicular joint. And that gives me my manubrium here, body of my sternum, and my xiphoid process down here. You should be able to see that in the slide too, I'm hoping. And you should be able to feel all of this. All this is 100% palpatable. I can feel my manubrium, and I can feel my xiphoid process. Boy, can I feel my xiphoid process. Yeah. And then you'll even see him make a distinction between the manubrium and the sternum, saying the joint between the things where that sternal angle is the sternal manubrial joint. You'll rarely hear people use that term, though.
Mr. Chapter?
Yeah.
So the manubrium is just like the layman sternum, like the top part of the tie. It's just that big bone area.
It is. It's just the top part of the sternum. I mean, I would think very good massage therapists sometimes just refer to it as the sternum, right? We only refer to the manubrium when we have to be really specific about that top part between the second rib and the first rib, kind of there. And I mention it too because it kind of explains the shape of your body. All of a sudden your sternum cuts way back in right there. But you're absolutely right. That is just part of the sternum. It really is. The manubrium is this top part of the sternum. And then you'll see here sternocostal joints. Costal means ribs, so a joint between your ribs and your sternum is a sternocostal joint. You'll see costal chondral joints, which is a joint between the sternum and the cartilage that connects your ribs to your chest, because there is cartilage that connects all your ribs to your chest. You want there to be cartilage. You want your rib cage to have bounce. In fact, as people get much older, some of that cartilage calcifies. So sometimes when they do CPR on really old people, they break ribs. One, because they're brittle, but also because some of that stuff's calcified and they're not as springy. And they'll actually break ribs. We can also see in this picture another one of my favorite joints, which is the Sacroiliac Joint. Right? For the same reason that L4, L5, and L5S1 are these high tension areas that have lots of problems, because they're at the end of the entire upper body kind of coming together, very much so is the Sacroiliac Joint. That's where the sacrum has to distribute all the weight of your upper body, all of it, to your hips. And that's the Sacroiliac Joint. Yeah. Cool, cool. Oh, well, that was not very long. Let's move on a little bit. Hold on. Bear with me. A little bit more. Okay. So, we've talked about ribs and we've talked about vertebrae, right? We've talked about the sternum and all that kind of stuff too. Let's talk about the vertebrae themselves. The vertebrae themselves, you guys already know some of this stuff, thank goodness, have parts on them. And we have names for those parts, and those parts are about to become very important because lots of stuff attaches to those parts. I'll come back to this one. But here is a very good example of a typical vertebrae. And remember, some of the stuff that makes it very typical for us is it has a spinous process, the things that stick out the posterior side of people's bodies that you can actually physically touch on everybody. Can't think of anybody who can't touch their spinous processes. All vertebrae have a spinous process except for which one?
Is it C1?
It is C1, and I appreciate you saying it. I appreciate the people out there that gave me a C and a 1 too. Thank you. It is C1, and that's so you can bend your head back, right? But all the other vertebrae have these spinous processes coming out. And what do we call the processes coming out to the sides?
Transverse process.
Transverse processes, thank you. If you look at this picture, there's some other really important features in here. One is they've actually named the space between the spinous process and the transverse process. They've named this space as the Lamina Groove. Have anybody heard this term yet? It might have come up in lab, it might not have. That's okay. So here's why the lamina groove is very important to us as massage therapists. The lamina groove is something that when we're getting really fancy with elbowing, we actually try to get our elbow right in the lamina groove. So when I come down your back with an elbow, I actually try to get my elbow to just barely kiss your spinous processes, and that means I've got it right in this little canyon on the side between the spinous process and the transverse process, and we call this the lamina groove. There's one on each side. When you guys are going down somebody's back sometimes with your fingers, you're probably in the lamina groove at times. If you're right next to the spinous processes, you're in the lamina groove. Now, it may not always feel like a groove to you because there's muscles running down the lamina groove too. But that's why it's important to us as massage therapists. We really care about it as an area that we want to get into. There's all sorts of small muscles that are in there. There's muscles in there that can be tight around nerve plexes that are pinching things off. And so we really care about the lamina groove. But the lamina groove is just a groove that's formed because you have space between spinous processes and transverse processes. And so you get this kind of groove in there. And that's called the lamina groove. Some of the other stuff where you see superior facets and things like that, that's because your vertebrae do hook onto each other. You guys will never see a superior facet, but these vertebrae even have superior and inferior facets. It's where the vertebrae actually hook together a little bit. So your vertebrae really do hook together. And these do too. These do too. They sit on each other. And last but not least, you will see these transverse foramen and vertebral foramen and all that. Anybody remember what a foramen is? No. Remember this. It's a hole. It's a hole, but there's a lot of them on your body, and we call them foramens. And there's this one that's in the bottom of your skull that hopefully you'll never see too. It's bad news if you see this one. That's called the foramen magnum. It's this big hole, and it's what your spinal cord comes out. You've got foramen in your pelvis that we're going to study, and really even in some of your muscles to allow nerves and veins to go through them. But it means hole. So, yes, Mr. Riedel.
Does your sacrum have foramen too?
Yeah, thank you. I'm all excited because that would have been a much better example to give had I given it myself, but you saved me. Thank you, sir. Yes. So your sacrum, because it's all these vertebrae that got fused together, it's got like 4 foramen on each side that nerves actually come out. So those are foramen. Yeah. Sacral, honestly, I think they're literally like called like sacral foramen.
Cool.
Yeah, very cool. And nerves come out of those, and that's one of the reasons we work the sacrum is because they get kind of caught up with fascia and things like that. So we work the sacrum for that reason. And in this picture, this big hole in the center that I don't think they labeled, but they should have, that's where your spinal cord goes down. Remember, your spinal cord's got to go down something. And so there is this hole down your vertebrae where the spinal cord goes. And it is truly impossible, to the best of my knowledge, to hit a spinal cord in massage. I'm saying this because you get people who are like, I've got a herniated disc, don't touch back there, you'll hit the disc. No, you won't. It's hidden behind all this bone. You gotta remember, this is the posterior view. You'd have to cut through bone to get to the spinal cord because there's more vertebrae on top of this one too. So you'd have to cut through bone to get to it. I'm not saying you couldn't manipulate the back to pinch on these little nerve plexes coming out, but you can't touch the spinal cord, or even the discs in back. Now you can do a lot to make them feel better or worse, but I just meant there's no way you could hit them. Yes, Miss McDowell.
So if someone has like bone spurs, like actually poking on their spinal cord, like my mom had that, would she not be able to have more like deeper pressure along the spine or the lamina groove because it would touch the spinal cord, or do you think there would be an issue with that?
No, I don't think there'd be an issue still. But here's where there might be an issue. No, the even with bone spurs, you're not going to be able to touch anything. But in your mom's case, is the bone spur so close to something that just me moving her back around bothers her? So not so much the depth, right?
Okay.
She would still be okay, even with I don't know what kind of massage she likes. Maybe she doesn't like depth, but in theory, she'll be able to handle depth. But what she might not like is certain stretches and twists that put her in a position where the nerve then gets impinged more, right?
Okay.
But still, my pressure probably wouldn't do anything unless it was moving a vertebrae enough that kind of irritated the spot. Yeah.
So not pressure, but movement would probably not be.
Yeah, I am more with back injuries, and this is good. Good question, by the way. Great question, and good for you all to kind of remember. I am more worried about manipulations, right? Because the spines, I'm more worried about twisting them around and things like that. And I'll still do it, but that's when I'm actually going extra slow. Pushing into their back, what I'm really worried about pushing their back is not actually hurting them going into a spasm or something. So, and that'll happen sometimes. You're in deep on somebody and they even like it and you come out too quick and then their muscles tighten up again and that makes their back pinch their thing and they, get the electric shocks. And so that's the type of stuff I worry about more. But no, basically no. Bone, did she get surgery for that?
Yeah, she.
There's not much else you can do. Not much you can do.
Yeah, I think they put metal in her back and they put cadaver bones. Just a lot of
stuff.
Yeah.
Yeah.
So.
Yeah, so they probably went in there and shaved down some of the calcium growths, although sometimes they're so close to the spine they can't. And then if you're telling me they put metal in there, usually that's to stop vertebrae from moving around and bothering you. But that's pretty invasive, yeah.
Yes.
Yeah. I mean, I don't know what else you do. It's the calcium growth is, Anyway, by the way, individuals like that sometimes benefit from massage in the sense that the massage relieves some of the tension around that area, but obviously we can't do anything about the spondylitis.
Yeah.
It's just, that's a bummer, but that's the way it kind of works. Yeah. All right. Good question. Thank you. Miss Suriel! Hi!
Hi, Mr. Kapskat.
Hey.
I'm so sorry.
That's okay. I need to know what you're grateful for today, though.
I'm grateful for opportunities and for good people.
Okay. Yeah. Sounds like you're talking about yourself, because you're a very good person. Yes. I love that. Okay, so the other vertebrae that they're going to show you look different, but they all have the same theme. So if we start at the very tippy top, you don't see some of these big structures because they're tiny little vertebrae. C1 is a tiny little vertebrae, which is mostly a big vertebral foramen for your spinal cord to go down through. But it's the same concept. So in your test, you'll have to name some of these areas. The stuff that I super duper care about for you guys though is spinous process and transverse processes going out to the side, because so many muscles attach to them, and ligaments and tendons, and it goes on and on and on. Cool. These are thoracic vertebrae. You'll notice the spinous process in your thoracic region, they come way down. Gives them better leverage for some of the muscles in your back to work. Cool. And these are lumbar vertebrae. The only difference is the body that actually supports the weight gets bigger down there. Because this is what's really getting stacked up. This stuff is all for muscles to grab onto and to protect your spine, but this is where the weight bearing is going. So by the time you get down the lumbar, you've got really big, obvious transverse processes and spinous processes and a big vertebral foramen and even bigger body. So on top of that body would be a cartilaginous pillow with another vertebrae on top of that one. Okay.
It's like an ice cream sandwich.
It is like an ice cream sandwich. I love ice cream sandwiches. I really do. Have you ever eaten an ice cream sandwich? They're not that big anymore either. Sometimes you eat one and I'm like, I can have 3 of these. They're so good. Anyway. Okay. We talked about your ribs having names. That you've got true ribs, false ribs, floating ribs. Yes? Cool. All right. I love that. Does that ring a bell, Mr. Placencia? The true ribs fall. Oh, good. Can you explain it to us, sir? Somebody's got to do my job, man. Oh, he's got to call in, too. It's so funny.
All right, I'm here. Whoa.
Oh, I like
All right.
it. You are here. Yeah, explain to us what makes a true rib, a false rib, a floating rib, if you don't mind.
Okay, I don't remember exactly which ones they are, but your true ribs are the ones that are connected to like actual ribs. Should be 7, is it?
7 of them. Yep, and those ribs have a direct connection to the sternum.
Yes, so the sternum. Yeah.
So they all hook to cartilage that takes them directly. Like this is your third rib here. It goes into its own cartilage and goes into the sternum. Cool. So those would be true ribs. Then false ribs.
They attach to just cartilage, not the sternum.
Yeah. So what they do is they steal 7's cartilage. They actually, this is rib 7 here. And so 8 actually hooks to rib 7 and then goes in. 9 actually hooks to rib 8 and goes in. So they're piggybacking on the cartilage of rib 7. They're false. False ribs. I don't know why that makes them false, but that's what everybody calls them. So that's, and they're saying 8 through 12. I was always just told 8, 9, and 10 are false ribs. And then what makes floating ribs, sir?
They're not attached to anything. They're just floating.
No, they're right. They're attached to the thoracic vertebrae and back, but they're just floating around back. By the way, everybody, they're not floating that much. Just to let you know, there's a whole bunch of fascia in there. You couldn't just but they are not hooked to the sternum at all. Good. Really well done. Thank you, sir. It's a beautiful explanation. Okay. That makes sense. Okay. Hey, Miss Hawks. How many floating ribs do I have?
2,
2. What numbers are they?
11, and 12.
Thank you, ma'am. How many true ribs do I have?
You have 7 true ribs.
Yeah, which numbers are they?
1 through 7.
Yeah, I think you got this. Thank you, ma'am. All right. We are not going to go into the exact anatomy of an actual rib because it's not really important for what we're doing here. Let's see. Now we're going to go into this. Okay. So here's what we're going to do is we're going to take a little break right here. Yep.
The insertion is the anterior surface of the scapula, medial border of the scapula.
Yeah, well said. Very well said. What 2 actions do both those muscles perform?
Abduct the scapula, depress, and oh my gosh.
Well, by the way, you've already answered the question. We sometimes call abducting when we're talking about the scapula protracting because it comes forward.
Protract. Okay.
But you already answered the question. Abduct and depress. Very good. Thank you. Miss McDowell.
Yes.
Okay, so Miss McDowell, we were talking about the 5 muscles that attach the scapula to the body. Just to help us all review, what are those 5 muscles that attach the scapula to the axial skeletal system?
Would it technically be 6 because the rhomboids are really 2, or do we really just count it as 5?
Yeah, absolutely. Depends on how you want to count them.
Well, it's rhomboids major, minor, or just rhomboids. Then trapezius, levator scapula, serratus anterior, and there's one more.
That works with serratus anterior and is in front.
The pec minor.
Yeah. Cool. Awesome. Okay. And what did we decide the origins were for the pec minor and the serratus anterior?
The origins for the pec minor ribs 3, 4, 5. And then the, which one did you want again?
Well, let's do the insertion for the pec, or the insertion for the pec minor. Let's finish that.
The pec goes to the coracoid process of the scapula.
Cool. Now, what about the serratus anterior?
That's the ribs 8 or 9.
Yeah. And they insert
And then
where?
that goes to, the medial border, the anterior side.
Yeah, it's very confusing, huh? Okay. So, how do you feel about the origins and insertions for the other 3 muscles on the back?
I kind of have.
Okay.
some of them,
Well,
maybe.
let's take a look. Let's take a look together. Let's look at trapezius. And there's a lot of fancy words in naming the origin of the trapezius, but you can even say it in some simpler terms if you want. Right?
So it's the occiput.
Yeah.
The
The external
chromium
occipital protuberance.
process. Yeah. The spine of the scapula, or is that the insertion?
That's an insertion, actually. But the origin
Okay.
is essentially from this bump all the way down to the spinous process of T12, right?
Okay.
Just to help everybody. Now, in your book, they get fancy and they say ligamentum nuchae, which we later find out hooks into all these spinous processes. They tell us stuff about the superior and inferior nuchal lines here. But simply put, it really does hook from the bump on the back of your head down to the bump of your last rib, right? So just a way to think about that. Then if you want to get fancy, you can name off all that stuff as you head down there, which is external occipital protuberance, medial portion of ligamentum nuchae. Medial portion of nuchal line, superior nuchal line, ligamentum nuchae, spinous process of however they put it, C7 or T1 to T12. Yeah.
Move on.
Cool. All right. So if that's true, it hooks to there. Where does it insert?
The spine of the scapula, the chromium process, and I think just a little bit of the clavicle.
Yeah, lateral 1/3. Good job. Good job. I think that's enough. Thank you.
Okay.
Yeah. Not because you weren't doing well, but I just think it's enough. Yeah. Miss Mares.
Yes.
Miss Mares, what is the origin and insertion of the trapezius?
So the origins are the occipital, the superior natural line, the spinous process, C7 through T12.
Good.
The insertions are the clavicle, the chromium process, and the scapular spine.
Yeah, good. Really good. Only thing I would add to that is just say it's the lateral 1/3 of the clavicle because it doesn't grab all the way up here. It grabs on out here. But yeah,
1/3 of
but you did great. Lateral 1/3 of the clavicle, a chromium process, turns into spinous scapula. Beautifully done. Yeah. What are the actions of the trapezius?
a lot of actions.
It does have a lot of actions, right? Because it's got fibers
Yeah.
running everywhere.
Beautiful movements. So extends, elevates
Extends what?
the neck.
Yes, it does. If it works bilaterally, it'll extend the neck. Good. Elevates the what?
The scapula.
Yes, elevates the scapula. Beautifully said.
Ready to continue?
Yeah! You're doing so good.
Okay, so it rotates the scapula,
It can rotate the scapula. You're right. Yeah.
and it also retracts the scapula.
Definitely retracts the scapula. Definitely adducts the scapula. I love that one.
Retracts it, depresses it,
And it
lowers
does do a depression. The lower fibers depress it too. Yeah.
and it also what else does it do?
It helps with some neck rotation to the opposite side and some lateral flexions if it's working unilaterally. But you did great. That's good. Thank you, ma'am. Really good. Good stuff. Miss Lobitz! Hi, Miss Lovitz. So, how are we feeling about our anatomy today, Miss Lovitz?
Not very well.
Not okay. All right. Well, then this is not going to be pleasant. Okay. Miss Lovitz, we were just talking about the trapezius. What's the origin insertion of the trapezius really quickly? Or really slowly, by the way, take your time.
The occipital protuberance.
Yes, that's a beautiful thing. External occipital protuberance, the bump on the back of the head. Beautiful.
T12. Is that right?
The spinous process of T12, yeah?
Yeah.
And then everything in between. I mean, that would actually be, I wouldn't want that on like a test, but that would technically be like where it is. It's between this bump and this bump, all the bumps up and down. So that's not bad. So external occipital protuberance, the medial portion of the superior nuchal line, ligamentum nuchae. It's okay. There's a lot going on.
It's dinner time for my dogs and they're driving me crazy. So also the spinous scapula, you get acromion, and then the clavicle as well, the lateral 1/3.
Yeah, it comes over here and inserts into here. Good. I think you did good. I really do. So let's talk about the other two muscles, or three, depending on how we want to count them. Let's talk about the levator scapula. Do you remember what the levator scapula went from where to where? Roughly? Yeah, you're touching it.
So it starts with the medial superior part of the.
Yeah, I love what you just said there. It essentially starts, and medial's fine too, you're absolutely right. But it essentially starts at the superior angle of the scapula, maybe this little medial portion way up here, but it's the last muscle to attach up here, you're absolutely right. And then it goes to the sides of the neck.
Yes.
So what are coming out the sides of vertebra?
Transverse process, 1st through 4th.
Yep, C1 through C4, transverse process. So we got this muscle kind of coming out from the tip-top angle of the scapula over in the side of the neck, C1 through C4. Beautifully done. And last but not least, let's do rhomboids really quick. Your rhomboids essentially go from what border of the scapula?
Medial.
Yes. Medial. I didn't mean that in a condescending way. I meant, like, I think you know some of this stuff and you're desperately looking it up when you already know it. So, medial border of the scapula, and then it likes to hook into spinous processes, right?
Yes.
The little guy likes to hook into two spinous processes. C7, and what's below C7?
T1.
Yes! C7, T1 is rhomboid minor, and then rhomboid major likes to grab onto twice as much as the rhomboid minor, so it grabs onto the next four things, so that's T2, T3, T4, T5. Boom. Beautiful. That was very good. It's very good. Got hungry dogs there? There's a lot going on. I get it. I really do. Okay. Cool, cool, cool. All right. Miss Carodi? Where did you go, Miss Carodi? Hi, Miss Carodi. Oh, can you see me? Yeah. I can't hear you. You're muted, Miss Carodi.
No.
There you go. Oh, Miss Carodi. Good. Let's review all the bones we've done so far. Okay? Yeah, because some people weren't paying attention, and now you got to fix it for them, Miss Carodi. I'm sorry. You got to carry the weight of the class. That's the way it goes. All right, Miss Carodi, what's this bone up here called?
Clavicle.
Clavicle. It turns into this bone back here. What's this bone back here? Yeah. What's this bone here called?
Humor.
Yes. What's this bone going to the thumb called?
Radius.
Radius, yeah. What's this bone coming off the elbow going to the little pinky called?
Ulna.
Yeah, good job. Okay. What is this thing called right here?
Manubrium.
Good. All right, so you're talking about the top part of the sternum, the manubrium. Good. What's this part down here, Miss Crody?
Vertebra.
Yeah. Sternal angle.
Sacroiliac.
But this is the manubrium.
Process. Sorry.
What?
So Sacroiliac.
I don't understand. You answered it right, but what's Miss Karodi? What's this little bone down here called at the bottom of the scapula? Yeah, xiphoid process. Good, good, good. Okay. And a couple more questions, really quick. What are the first 7 ribs called? The first 7 ribs. True ribs, yes. What are the next 3 ribs called?
False.
False, yes. And what are the last 2 ribs called? Floating. Yeah, that was great, Miss Crody. Thank you. Really well done. Cool, cool, cool. All right, Miss Hawks. Hi, Miss Hawks. What are the 5 muscles now that attach the scapula onto the body?
The rhomboids, the trapezius, levator scapula, serratus anterior, and pec minor.
Yeah. Which ones of those sometimes work together? Depends on if they're cooperating or not. Yeah. Do any of them ring a bell in the sense that, like, you're like, oh, these 2 probably work together, or you're just like, that makes no sense to me, Tapscott?
It really makes no sense
Okay.
to me, Tapscott.
You got it. Thank you. Okay. So, just really quick, just to give you an example, if this is kind of how the trapezius looks, right here, it's got somebody's head up here, right? Their shoulders over here. But this is how your trapezius looks. What would these upper fibers probably do, Miss Hawks? What kind of action would they create, the upper fibers? They're both going up like this. If they contracted, what do you think might happen?
They would elevate.
Yeah, they'd elevate the scapula. So we've got another muscle up there called your levator scapula, which is hooked to the same spot basically and goes in the side of your neck. And so just by looking at it here, you can kind of tell it's going to do the same thing as the upper trapezius. Does that make sense?
Yeah.
Cool. So we often think upper trapezius and levator scapula work together. We also think in the middle, we've got the rhomboids. And so we often say middle traps and rhomboids work together. And then in front, we've got the pec minor and the serratus anterior, and they both protract and depress the scapula, so we'll often say they work together. These aren't even like, I'm doing this to help you guys group knowledge, if that makes sense. So we're always trying to group it in different ways, put it together in different ways, things like that. It's not that massage therapists walk around all day long and like, levator scapula and upper traps, but it helps you start to think about muscles working in groups and things like that. Good job, Miss Hawks. Thank you for being so honest. I'm sure you're not the only one who felt that way. Believe me. Cool, cool, cool. All right, Miss Estes. Hi.
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 Hello.
Hello, Miss Estes. Okay. How you feeling about all this?
I'm soaking it in.
I think so. Like a sponge. Yeah. I always feel like there's like several running jokes behind all this stuff. I can look around people. Anyway. All right. What are the 5 muscles that attach the scapula onto the body?
That is the levator scapula, the trapezius, the pec minor, right? Pec minor, the serratus anterior, and the rhomboids.
Yeah. Well done. What groups like to work together?
The levator scapula and the trapezius.
Yeah. Give me.
And then the other ones, the serratus anterior and the pec.
Yeah.
Right?
Yeah. And who do the rhomboids like to work with?
Rhomboids and the trapezius.
Yeah,
middle
traps.
fibers.
Yeah, middle fibers probably. Maybe even upper. But anyway, that's good. Okay. So just these 5 muscles. That's all I'm talking about right now, okay?
Okay.
Which one of those 5 muscles has an attachment on the coracoid process?
Coracoid. That is the pec minor.
Yes. Which one of those muscles has an attachment on the external surface of the first 8 or 9 ribs?
External surface of the 8 or 9 ribs. That's the trapezius. External surface of 8 or 9 ribs. Yeah. Is it the trapezius?
Does the trapezius actually grab onto ribs?
Oh, you said ribs. I'm thinking of spinous processes. Okay.
Oh, good. Good. You're right. That would
No.
be.
Okay. Of those 4, of the 8 or 9 ribs.
Of those 5. Yeah.
I mean, of those 5, serratus.
Serratus anterior. Yes. Yeah. Very good. Of those muscles, of those 5 muscles, which one likes to grab onto the medial border of the scapula?
The serratus anterior, as well as another one. The trapezius? Huh?
No, trapezius doesn't grab on the border of the scapula. It grabs
the
on the
border of the
spine,
scapula.
spine of the scapula and the acromion process stuff like that, but not the medial border.
Rhomboids.
Oh, rhomboids and serratus anterior, yeah. And by the way,
Yeah.
you could even argue levator scapula. It's way up high, but it's still medial border.
Okay.
So, I know it sounds weird, but rhomboid major, rhomboid minor, levator scapula.
Okay.
And
Wow.
serratus anterior on the whole front of that. So it's kind of it was a leading question. It was great that you kind of saw there's more than one answer. Really well done. Really well done. Cool. So you're soaking pretty good.
Yeah, the recall. I'm glad you called on me.
Yeah.
I didn't know I knew it exactly, so that's good.
Piece of cake. Whatever you're doing, keep doing it. Cool. Thank you. Mr. Brown. Mr. Brown. Hello, sir. Hey, Mr. Brown, what are the 5 muscles that attach the scapula to the axial skeletal system?
The infraspinatus. Wait, why is it not wrong? No, yeah, infraspinatus, supraspinatus, the last one that's like on the inside.
Well, I think you're trying to say the 4 rotator cuff muscles, which is not what I asked, but is an important thing to know. So, what are the 4 rotator cuff muscles? Supraspinatus.
Wait, so I was saying the rotator cuff muscles, I thought that was the 4, and then...
Well, really, I wanted to know the 5 muscles that attach the scapula to the body. But you started giving me rotator cuff muscles, so I was going to take those.
Oh. The infraspinatus, supraspinatus, and then teres major and minor? I'm all sorts of confused right now.
I know. Okay. Okay, sir. Let's get you out of your confusion. Really quickly, let's say the 4 rotator cuff muscles. And that's supraspinatus, infraspinatus. Anytime I say infraspinatus, which is a tiny muscle, you say teres
minor.
Good. And then there's one underneath here called subscapularis.
Subscapularis. That's the one I was thinking infrascapularis, but that's not a thing.
No, but I see where you're coming from with that. I really do. So these are muscles that help hook your humerus onto your scapula, and that's awesome. But I want to know what hooks your scapula onto your body. Your body. And there are muscles that attach your scapula to your rib cage, to your spine, to your head. And there are 5 of them, 6 depending on how you count them. Do you know what those are?
Let's go over them.
Okay, I like that. Let's go over them. Yeah. Do you want me to give you some hints?
Hold on, give me 1 second.
Oh, sure.
What is it, Pop?
Oh, he's talking to me.
What are you messing with the macaroni for? You're supposed to be.
I didn't realize there was macaroni involved. That's pretty serious. I have.
Yes. Can I get some hints?
Yes, sir. Let's do that. Okay. Okay. There's 3 in back and 2 in front. Let's talk about the 2 in front. What is this the sign for?
This is the sign for. Not the lats. The lats are back here. This is the. Traps? No. So
Well,
right here.
Hold on,
But they come around.
Mr. Brown, hold on 1 second. Miss Sarno's going to bail us out on this one. Miss Sarno, what muscle is this?
Pectoralis major.
Minor.
Minor.
Good.
Pectoralis minor.
So this is pectoralis minor, sir.
The pec minor is the 3.
Yeah. Goes into ribs 3, 4, and 5. And it comes from the coracoid process of your scapula. So that's one that's in front. And then you got these finger-like projections that come out and wrap around your ribs and also attach to the scapula.
On the side?
Yeah.
That's the Serratus Anterior.
Yeah, Serratus Anterior. All right, so Serratus Anterior and pec minor have been known to hang out together. They kind of like each other. And they'll usually work together. So that's the 2 in front. Then we got 3 in back. We got a big diamond-shaped muscle in back that hooks pretty much from the back of your head down to T12 and then hooks onto your scapula. Do you know what that big diamond-shaped muscle is called?
That one was the
Trapezius.
Yes, trapezius. Then the upper fibers of the trapezius like to work with another tiny muscle that helps to elevate your scapula. Do you know what that muscle's called?
That was the pec minor? Or is that still in the front?
Yeah, we're in back now. That's Levator Scapula.
Levator Scapula. And then the rhomboids were back there as well?
There you go. So, what 5 muscles did you just give us?
Pec minor, Serratus Anterior, Levator Scapula, the Trapezius, and the last one was
You know it. You said it.
rhomboids.
Yes. Good job. Thank you, sir. Mr. Blygen.
Hey.
Hey, buddy. Hey, last but not least, I want to ask you a couple of quick questions before we release homework here. Of these 5 muscles, you're aware of the 5 muscles that attach the scapula to the body, right? The trapezius, levator scapula, rhomboids, major and minor, serratus anterior, and pec minor, right?
Yes.
I want to ask you questions about them, and you just tell me which ones of those 5 are the answer to my questions. So, which of those muscles can create a depression of the scapula?
The trapezius.
Which fibers?
The lower fibers.
Very good answer, sir. Thank you. Very bright. So trapezius. Anything else?
You said depression of the scapula. So we are looking at also the, because rhomboids does that. We're looking at the, not the levator scapula, trapezius, and the serratus anterior. No,
it does actually, sir. Sir,
attached to the medial border.
yeah, but it does run diagonal down. By the way, you answered this question exactly the way I think it should be answered. When I asked what depressed the scapula, you gave me the #1 depressor out of those 5, which is lower fibers of the trapezius. They're designed to do that. We can kind of see them pulling down. That's excellent. The serratus anterior and the pec minor, though, do run not only forward, but diagonally down. So they would also be depressors.
Mm-hmm.
But you did a great job at, like, giving me the obvious depressor. Like, really, you should list low traps first. But then, yeah, you would throw in pec minor and serratus anterior, too. Does that make sense?
Mm-hmm.
Cool. Can you give me muscles that would, of those 5, that would elevate the scapula?
The levator scapula, the upper fibers of the trapezius, and elevate, so the Rhomboids?
Yeah, he's right, everybody. Do we realize why he's right? The rhomboids do run up at a slight angle. Now, we normally care about them because they adduct, they retract my scapula. That's their main job. But because they run at an angle, they can help to elevate. He answered the question correctly. Those three muscles. Very good job, sir. Not just a pretty face. I'm trying to think if I had anything else to ask you. Which one of those muscles can, which one of those muscles can pinch on the brachial plexus?
Brachial plexus that can pinch, so that would be the Serratus Anterior.
Probably not that one.
Oh wait, the plexus is the bundle of nerves that go down this, so then the Levator Scapula.
Yeah, Levator Scapula is an excellent guess because it could literally pinch it up here, and then Pec Minor could actually get it down here. Because the plexus kind of comes out like this. So you were right, by the way. The Levator Scapula would be the first one I would worry about, and then Pec Minor down here. Could actually go over it too. Good answers. I really like the way you are thinking, because I hope you guys recognize what he's doing. He's not just memorizing answers. He's actually visualizing the muscle and thinking, will it do what he's asking? And this is a very good long-term way to remember stuff. So excellent job. Thank you, sir.
Yeah.
Yeah. Okay, everybody. I have released tonight's homework. I'm going to, just so you guys don't freak out, just hear me out here. I'm going to release tomorrow night's homework too. So you will see different due dates. There is a short, like 22 question quiz due tomorrow morning by 8. There is a good, long 120 question test that's due the next morning after 8. I released it now because it's really over a lot of the bones that we've done so far. And so you should be able to take them both if you didn't want your homework to pack up at a certain, you know what I mean? I know for some of you, you only have tonight for your quiz. You're fine. Do your quiz and be done with it. But if you find yourself with extra time and you want to get like a big step ahead on tomorrow night's homework, I thought this would be helpful because I think you already know your vertebrae and the bones of the upper body pretty well. So I've released 2 pieces of homework. One is due tomorrow. The next one is due the day after tomorrow. So don't panic. They're there for your convenience. And I'm going to stay here and answer questions and all that good stuff. And we can work on that for the next 30 minutes. Yay!
Mr. Jessica?
Yeah. Yes, Ms.
Are we
Bell.
going to have MT book homework tomorrow?
We will have, we're actually looking at a chapter, after tomorrow, we're looking at chapter 10 in your massage therapy book. Yeah, chapter 10, which is professional something. I forget what the whole title is, but it's chapter 10. So there would be some matching probably assigned tomorrow for that end of that chapter. But again, you have 2 assignments out. Only one is due tomorrow. The next one is due the day after tomorrow. But you can obviously finish it early if you want. And I will be right back.
All right.
Oh, that's funny. That's funny. Yes, Miss Sarno.
My they show only one, and after that I have to click next. I don't see the whole of the
Oh, I don't like when it does that. Hold on. Let me see if I can fix that. Let me see here. Hold on. Yeah. Okay. Ms. Sarno, I fixed that. You might have to get out and then come back in, but you'll be able to. You should be able to see it normal.
Mine's doing it too, but I already started. Is that?
You should be able to leave it and come back and have it still work. Don't submit it.
Okay.
Yeah, Miss McDowell says. Which either means she agrees with me or she's talking about elevating something. Yes, Mr. Crody. Sorry, sir. Yes, sir.
There we go. Okay, I was looking in and out during the conversation you guys were having about lost time being made up.
Yes.
I know it needs to be made up by the end of class 1 so that you can proceed to class 2.
Yeah.
Now, are we just going to piggyback one day? Because I think she's like 3 hours, so she can stick around on a Thursday for.
Exactly. So what we do is we build in 2 extra days at the end of every class.
Okay.
And so if you don't have anything to make up, you get those days off. But what I was trying to explain was, and I did not do a very good job, is that this class doesn't end exactly like at the end of a day. And so we're going to get some hidden makeup hours in that time. And so she might be able to be done without using up even one of those 2 makeup days.
Okay,
but sir, it will flow seamlessly. So even if like she didn't know, I'd just be like, Miss Carota, you need to stay here with me, because her time would just keep running and then we release her. So it's built into the program.
Okay, thank you. And one other question, I don't know how specific it can be. Are there tests at the end of each class, like after stage 1, or is there just a test at the end? Yeah. Or how does that pan out?
There are pretty much no cumulative tests. I think that's what you're asking.
Yeah, so, I mean, at the end, you don't have to take a final exam.
No, there is a final exam, sir, but it's not. In my mind, it's not a final exam. So it's a final exam because it's 100 questions and it's on all the muscles.
Okay.
I don't consider it a final exam because they're going to go into that test with probably 1,000 points in the class. So it's not weighted like a final exam, if that makes sense. It's not a make or break thing, even though it's 100 points. It's not a make or break thing, unless, by the way, you are really teetering on the edge. But that is
if you're well above the 80% threshold, that final test shouldn't really matter much at all. And is it done in the same format on Canvas or
yeah.
Okay.
It's done on Canvas, but it's the one that we do at the school, so you can't. Okay. And we would just do it at lab time someday or something. But we do it so that you can't. It's not cheat, by the way. We do it so you can't use your book. We get a real measure for like, what did you really pick up muscle wise? What we never retest you on, and maybe we should, but I can explain the whole reason we don't. Is like once we do one of these things like the muscular system, we don't ever come back and do a cumulative test on that. We might review that stuff. I might ask you questions about it. But no. There is only one cumulative test at the end, and it's at the end of this entire program, and it is on muscles only, and it's 100 multiple choice questions. And I think you guys will be surprised at how well you do on it, because my whole goal is making sure that test is easy.
Well, there's a ton of time left. We're just just trying to make sure that we're going to be all right. So.
Well, yeah, I can. Well, yeah. I was trying to think of reassuring things to say, but the most reassuring thing I can say is that our program is a 95% graduation rate. So when I lose students, it's usually not even for grades. It's usually for attendance. Occasionally somebody it's for grades, but I have to tell you, it's laziness at that point. They're not doing their tests and they're racking up zeros, and they get zeros kill you. By the way, I saw some of you guys do it, and it was a smart move. If you think you're not going to get your homework done, at least do something, because you want something going in over a 0. But anyway, no, there's no unexpected stuff on our end, sir. She's gonna, as well as she's doing now, she's gonna keep doing that all the way through.
Okay, I appreciate it. Thank you.
I appreciate it too. It's nice to have somebody who really is working hard. It's great.
Yeah, she's putting in the work. I just want to make sure.
Yeah,
that it's not
there's no surprise at the end. There's no surprise.
Okay. Yeah, I appreciate it. Thank you.
Thank you. Yeah. And if anything, some people argue with me about this, but if anything, the course gets easier towards the end, because by then you guys know an awful lot.